So my aha moment with Nodify was when I had my first nodule that I was convinced was not cancer. But I ran the test anyway. And I ran it because I wanted to find out as much as I could about this test and how it dealt with nodules. I've been doing this a long time. I've looked at thousands of CAT scans. And in my head, I was convinced I knew what lung cancer looked like. Many doctors are convinced that we know what lung cancer looks like. So I had a patient that had a nodule that was of a moderate risk, but it was a low moderate risk. And I said, you know what, we're going to let's going to get another CT in 3 months. It was a lung cancer screening patient because I didn't think we needed to biopsy this. And when you tell a patient, by the way, you're doing a scan in 3 months, which is standard practice, that's a long time. If they find you've talking about a lung nodule you found and you're going to wait 3 months until we look at this again. So then I had part of the conversation was, well, in the meantime, why don't we do Nodify, this new blood test? Explain to them what that meant. And I'm going to have these results back within a few days, and we're going to call and we'll see. And that was part of my kind of standard practice. In many patients, had the conversation where it's like, you know what, the blood work looked good. Your Nodify test looked favorable. It looked like it was less risk. I think we're on the right path. Let's just get that CT in 3 months. I think we're going down the right pathway with that. But the first time that I was expecting to have that, and then I saw that risk went from 25% to 65% in a nodule that I knew in my head wasn't cancer, it really opened my eyes to really how much we know, but how much we don't know, and how we can't necessarily be confident just on pixels on a screen of what that diagnosis is. So then I had a very different conversation with the patient and said, you know, I know we were planning on that 3-month CT, but I need you to come back because we found something that's making me more concerned than I was before. And the patient was thankful that we took that extra step to test them above and beyond what standard practice was and really do what beyond standard and appropriate practice was for them and diagnose their cancer 3 months earlier than we would have if we had not done the test. And that's what made me realize that I need every tool that I can to make sure I'm working up these nodules as thoroughly and as appropriately as possible.
My aha moment with Nodify came after I'd been using it for 4 or 5 months, and I had a patient who was a veteran who had a relatively small peripheral nodule that was not easily biopsyable. They worked in the healthcare field as well, so they were a sophisticated patient, and they saw me for the nodule. We talked about it. I recommended short-term surveillance imaging. We got Nodify results. Nodify results take about 3 to 5 days in my experience. In those 3 to 5 days, he also saw a thoracic surgeon at another institution, and the thoracic surgeon recommended resection. He said, this is a nothing little tiny nodule. There's no way that this should be causing you any consternation. If this is bothering you at all, let's just get it out of there. It's a quick little surgery. Patient opted to go that route despite Nodify results that came back as about 5% malignancy risk. And I told him that, listen, this substantiates my initial inclination to surveil this. That patient wound up going for the resection, and he called me up a couple weeks after that. And he said, listen, I just wanted to let you know that you were right. My biopsy came back as benign. You were right, and Nodify was right. And I'm kicking myself now because I have this horrible intercostal nerve pain, and I'm on gabapentin 3 times a day now. I mean, this was a relatively young, robust, former veteran. And so it was, that case in particular that sticks with me, kind of solidified the impact that this test can have in how you can be more thoughtful for nodules and not just reflexively biopsy everything that walks through the door simply because you can.